well dignitaries on the dais and of the dais, inclusive of all, including Dr. Saji Thomas, to whom we heard. He is Vice President at national level. Dr. Ritesh Raj, President of this chapter. Our Medical Superintendent, Dr. Hiren Birua, Dr. Sahi, Dr. Prajapati, Dr. Om Prakash, Subdean Dr. Prasant. The rest of the senior people I can see, I don't know the name. I wish that they will forgive me for not addressing by the name. Well, I don't know where to start it with, but let me say, tell that any surgeon, wherever the surgeon is written, I have lot of affinity. Be they maxillofacial surgeon, be they general surgeon, be they gastro surgeon, be they urosurgeon, whatever surgeons you know, I have lot of fascination for them. So much so that I was a founder of a trauma center at SGPGI, where the first Narial was broken by me along with my director. It was 250 bedded hospital. When the issue for the creation of post came to me, because I was the initiator, the entire unit was right from the architectural designing to the monitoring of the building was done by me. And when I say me, it means me, because nobody was interested in that campus, because the campus was separate. I was so much singled out that I had to go to Vidhan Parishad. You know, in bigger state you have Vidhan Parishad also, Legislative Council. Council to reply the questions raised by the faculty of the institute as to why the separate campus is going to be developed. So obviously I was the person to whom the responsibility was assigned to create the posts. So people said, why don't you ask for the trauma surgeon, neurosurgeon, orthopedic surgeon, maybe gastro surgeon, because these are the main specialties for the trauma. I said no. There must be a maxillofacial surgeon and there must be a rehabilitation unit. And today, after that, after creation of the post, I had gone to another institute as a vice chancellor of medical university, and the maxillofacial surgeon is working there, and when I saw him, I was very delighted to see. Probably OT is going to be completed, and I believe that would be mainly dedicated to maxillofacial surgery, if I am not mistaken. Is it so? Right. Thomas was talking about what Lord Christ or some God said. I know that the Buddha said that the human being or any being, whosoever is born on the earth, is vulnerable and supposed to suffer. The sufferings, the pains, sorrow, lamentation, and different kinds of the despairs, different kinds of the sufferings are here on the earth, and every sentient being will have to suffer. There is no exception to it. Be you a neurosurgeon, be you prime minister, be you president, be you whatever, but you will have to suffer at one or other stage of the life. And Buddha said that there are two types of the sufferings. Number one, because of the body and because of the mind. That is a very long subject. I will not deal with that because it would be out of the context if I keep talking about that. But what I mean to emphasize here, that the body sufferings which are there for every human being If the body suffers, whatever pleasures or whatever kind of luxury you have, you can never enjoy. To enjoy the life, one need to have a peaceful, pleasant mind, then only can somebody enjoy. And if the disease occurs in the body, obviously, howsoever huge, enormous amount of money and fund and luxury you have, you cannot enjoy even if you have a simple pain on your cheek or in one of your denture. And you are the people, subject is different. Buddha said, how do I cure the ailing society? The same way the doctors are meant here on this earth to alleviate the pain of sufferings. And we earn our bread and butter by relieving the pains. And you as a maxillofacial surgeons are people who try to eradicate the pain from the oral cavity. That is something more fascinating. So I like the oral and maxillofacial people most because today the maxillofacial surgery what I saw during my training is not the same. Today in the country we are champion in trauma. There is every minute an accident and every 4 minutes one person dies on account of the road traffic accident. 1.5 to 2 million accidents occur every year and 1.5 lakh people die in India because of the road traffic accidents. And needless to say, most of them are obviously the head injuries, followed by orthopedic injuries, followed by the abdominal injuries. And the maxillofacial injuries are not uncommon. They are equally important. We do not realize this fact because we do not deal separately in trauma centers. But I as a ex-chief of the trauma center can spell you out that several patients would have died had there not been a posting of maxillofacial surgeon. Why so? Why so? Because once there is a leaf-fold fracture or the fracture of one of the teeth or the foreign bodies in the oral cavity, if the respiratory airway by any of the method is compromised, patient is going to die with aspiration pneumonitis rather than the intracranial elevated hypertension. That is what the scenario is. The thing is very small. The maxilla is flail because of the accident, because of the fracture. The saliva, because of the foreign body has lodged inside the oral cavity because of the bleeding or because of the blood clot or because of the foreign body. And if the patient fail to breathe, you can understand that within 2 minutes the brain will start dying, and whatever dies in the brain, it does not revive. This is the natural phenomenon. Patient will die on account of aspiration pneumonitis, hypoxia rather than head injury or bony injury or long bone fracture or whatever. So maxillofacial surgery is something which is the emerging branch today. In my simple chronology and understanding and semantic, I can say with the upcoming super specialties from the surgery, the maxillofacial surgery is independent surgery, probably more demanding than general surgery because of the development of the super specialties. If you do MS general surgery, you can become plastic surgeon, pediatric surgeon, neurosurgeon, neurologist, blah blah blah, super specialists like pediatric neurosurgeon and whatnot. But in maxillofacial surgery, you are maxillofacial surgeon and you are master of this area. This is something very unique to you people. Maxilla surgery is not only confined to, only for the trauma, but as far as my understanding goes, that orthognathic surgeries are done by you people. The oncology of, oh my God, the oral cancers, probably we are topper in oral cancers. And I was reading a text someday, because I keep reading, I am a student of my life, I still read. because I am a teacher, so I cannot remain devoid of reading and teaching because I have come to the administration. So I was reading a paper probably from maxillofacial surgery itself, where it was claimed that the oral cancers have highest incidence in India because of the tobacco and smoking and tobacco chewing and otherwise also if you go through the incidence, 25 to 30% of the cancers are attributed to the tobacco in one or different forms throughout the globe. Indian scenario is relatively more different. And it was mentioned in a study that up to the 50 to 70% mortalities out of all cancers are attributed because of the oral cancers. It's a very high incidence. We know all these facts today. What we need to know, and it is a challenge for new generation, as to understand as to what are the causations for these things. Are these only confined to tobacco? Or these have gone beyond tobacco and smoking, or say melanoplakia, leukoplakia, scar and ulcers, candidiasis, HIV, with the emergence of HIV, human papilloma virus, of course, 16 strain is known for the cancer, if I am not mistaken, hope I am not mistaken. So, despite these, it is a challenge for new generation to learn something more about, say for polymorphism, say for the cancers which are common in bladder, they have genetic causations. Say the role of P53 mutant gene, the role of EGF, the role of different kinds of the oncogenes, the role of KRAS, the role, different kinds of the genes have taken over as far as the oncology research is concerned, but unfortunately we could not reach to any level. Yet it is claimed that nearly 40 to 60% cancers are preventable by different measures if they are taken by keeping and retaining the weight, by exercise, by dietary balances, by supplementations, by lemonoids, by flavonoids, by different kinds of the green leafy vegetables. So this is a different story. What I wish to convey to maxillofacial gathering, that your job does not remain confined only to the limited surgery. Your job is much expanded. It has expanded to the trauma, it has expanded to the cleft lip, it has expanded to the congenital anomalies of the face, it has extended to the gnathic abnormalities and malformations. And nowadays I heard that in Hyderabad or in Ahmedabad, the hair transplants have been taken over by the maxillofacial surgeon. They are doing vehemently. So, obviously, if I keep on speaking, this is probably my bad trait that if I start speaking, I start and keep going. I will not take much of time. And thank you for tolerating me for these many minutes.